Good afternoon, everyone, and a very happy Ramadan to all our viewers. Uh, Irritable bowel syndrome, a very important topic that needs to be discussed among the patients, among the members. Awareness has to be spread out about it. That is very important topic today. I have here with me Dr. Srinivas, who is a specialist gastroenterologist in Prime Medical Center, Burjuman, Bersha, and Jumeirah. Dr. Srinivas, thank you for joining us today. Dr. Srinivas has an extensive experience of 8 years, out of which 2.5 years for the last 2.5 years, I should say, he's practicing in UAE. Today's topic, as I said, it's irritable bowel syndrome. We're going to look into just special insights on benefits of fasting and COVID-19 that will be related to the topic. And of course, the top four causes of IBS, which is a small intestinal bacterial overgrowth, candida, I should say, parasites, and food intolerance. And these are the treatable conditions which doctor is going to talk about. And obviously, we'll be taking your questions from here onwards. Once doctor is done with the initial talk on the topic, we will be taking your live questions and we will answer all those questions who have also come through the registrations. So thank you very much, everyone, for joining us. So stay tuned with us for the next 1 hour, and it will be a very helpful and important topic to you. Doctor, thank you very much once again for joining. Talking about irritable bowel syndrome, a very important topic to be discussed, doctor. Obviously, the topic is very large. It may not finish in 1 hour, but we need to look into or we need to touch the main important points which are important that people should know about. So we are waiting to listen from you. Thank you. Over to you.
Uh, Thank you, Mr. Fahad, for the kind introduction. Good afternoon, a very good afternoon to all of you, and a very happy Ramadan Kareem to all of my brothers and sisters. And here, I'm Dr. Srinivas, specialist gastroenterologist from Prime Medical Center, Burjiman. I'm here to share my experience and knowledge in the field of irritable bowel syndrome. Today is a good day to share all this experience, and I thank Prime Medical Group for giving me this opportunity to share the experience and knowledge, whatever I have gathered through years of the clinical practice. And yeah, without wasting much time, we shall be going into the topic. So, the irritable bowel syndrome, or the IBS, is a very well known word recently coming up in the medical clinics as well as the hospitals, and even the patients are also very much aware of it, what it is. But there is always certain confusion regarding this entity about what causes this IBS and what are the main reasons for the IBS. Because in the previous years, maybe a decade ago, it was thought to be purely a psychological disorder with no specific medication available. But now, through years of medical research, we have identified certain important causes of this disease, so that now we know that there are certain treatable causes for this disease, like, as already mentioned, the SIBO, the parasites, as well as the food intolerances or food allergies as maybe probable causes of this disease. And first of all, one should know what exactly is this IBS consists of. IBS, or irritable bowel syndrome, otherwise known as nervous colon or the functional bowel disease called previously. So this consists of a symptom complex which consists of four major symptoms. One is abdominal pain and bloating, constipation, and diarrhea. These are the four cardinal symptoms of the disease. Of course, these cardinal symptoms can be present in many other conditions, so it should not be confused with the other conditions which have their own specific causes. But depending upon the pattern of these symptoms, we diagnose in clinics the IBS for our patients. Recently, we have been observing that the number of patients coming with the pattern of IBS symptoms is increasing to the extent that almost 15 to 30% of our patients are complaining of IBS related symptoms or IBS related etiologies also. So, in this context, we felt that it is a good topic to take it up for today's discussion. And whenever a patient is having this either abdominal pain or bloating or diarrhea or constipation in a recurrent pattern, that means the symptom should be recurring frequently, at least once in a week, then there must be a suspicion of IBS in patient's mind, and he should approach the doctor to know whether he is really having the IBS or not. For the diagnosis of IBS, we have certain criteria because these symptoms of the disease are very non-specific. So the pattern of the symptoms is more important. Clinically, whenever a patient presents to us with the symptoms of IBS or symptoms related to IBS, what we check is how chronic the symptoms are. Like recent onset symptoms are not very significant, whereas the symptoms which are happening again and again over the last 3 months of uh, period before presenting the clinics are much more significant. So any of these symptoms happening for recurrently over last 3 months before presenting to the clinics gives us a suspicion that the patient may be having an IBS. And another important symptom of all this is an abdominal pain or abdominal discomfort, which may be because of many reasons, like the pain sensitivity of the gut is altered in IBS patients, and also there are certain abnormal chemical release in the intestine, which is making the pain nerve endings of the intestine much more sensitive even to the normal stimuli. So the abdominal pain is considered to be one of the important symptoms without which we usually suspect uh, the IBS diagnosis. The other symptoms like the bloating is another second most important finding or second most important symptom presented by many patients is mainly because of either excess production of gas in the intestines or colon, or maybe because of the abnormal chemical interactions like the abnormal metabolism of 5-hydroxytryptamine. It is a very special chemical released in the intestines for the propagation of intestinal movements. When this chemicals metabolism goes a little abnormal, there may be either diarrhea or constipation, which is happening alternatively, which is again a characteristic of IBS. And of course, the diarrhea and constipation in IBS actually makes the disease to divide into 2 to 3 categories, like the diarrhea predominant IBS, constipation predominant IBS, and a mixed type of IBS. And usually in the clinics, we see a mixed type of IBS to be more common than the either diarrhea or constipation predominant IBS. So whenever the patient is presenting with this kind of symptoms, we usually check clinically if there is any abnormal uh, findings we can find to identify an organic disease, because these symptoms can also be presenting in many of the organic diseases, especially if the patient is more than 50 years age group, to rule out certain important diseases like malignancies. And if it is a young patient below 40 years age group, we need to check if there is any other disease like an inflammatory bowel disease or any other food intolerances or certain conditions like the SIBO, any parasitic infections, or any food allergies. So, basing on all this, I would like to throw a little bit light on these 4 specific entities which can cause the IBS in many people. So, importantly, as the cause of IBS, SIBO is coming up as a recent research point in many of the countries. SIBO means small intestinal bacterial overgrowth. That means usually our intestines contain certain number of bacteria per square centimeter. If the number of this bacteria goes up beyond certain limit, there is something called dysbiosis. That means the disturbance of balance between the good and bad chemicals in the intestine, which actually can create an environment favorable for the symptom development in IBS. So, in the clinical research, we have identified that many of the IBS patients have these bacteria in higher numbers than the normal persons. So, in this construct, scientists think that SIBO have a very specific association with this IBS. if not the sole contributing factor. The another important thing is the parasites, especially like the uh, blastocystis, giardia, and cryptosporidium parvum are the parasites which are identified in higher numbers in the bowel of IBS patients than the normal population. So nowadays we are thinking that they may have some contributory role definitely in the development of IBS. And the other thing is a specific fungus called Candida. Candida is a very common fungus present in the human gut in limited numbers. But if the numbers of this Candida albicans goes beyond the limit, maybe because of the alteration in the immunity level of the patient, or maybe because of some medications like immunosuppressing medication, chemotherapy, and any other stressful conditions which will lower the mucosal immunity of the gut, the numbers of Candida will go up and it can specifically result in IBS symptoms. So it is also identified in higher numbers in the bowel of IBS patients nowadays. And last but not the least is the role of food intolerances. Food intolerances was once thought to be not much related to the IBS, but recently we have identified that the specific food intolerances like the gluten intolerance, the lactose intolerance, and the fructose intolerance, the antibodies related to these uh, diseases are found in higher numbers in the mucosal evaluations of IBS patients. So, in this context, it is imperative that definitely these food intolerances have some role in the development of IBS, if not completely sole contributing factors. The other factors which also can lead to this IBS are like the female gender and the certain psychological states like anxiety, depression, uh, which is a difficult thing to assess, like whether it is the cause or is it the result of the IBS symptoms. Because many patients, after suffering from symptoms for many years of IBS, they will slowly go into a state of anxiety or depression, and then it will be very difficult for us to identify whether this anxiety or depression is the main reason or the symptoms are causing this anxiety. But of course, with a proper clinical evaluation and certain treatment modalities, we will be able to identify whether it is really an IBS or an anxiety related bowel disorder. So these are the various contributing factors for the development of this recently upcoming disease called IBS or irritable bowel syndrome. But since the symptoms are very non-specific and they can be present in other diseases, there are certain red flag signs I need to emphasize at this point, because thinking of IBS is a good thing, but we should not miss any other major disease like a malignancy or inflammatory bowel disease, which have a more specific treatment and which have a more specific clinical course. And if neglected, they can turn out to be dangerous in long term. So, whenever a patient presents with the IBS symptoms, we should be thinking in terms of any alarming symptoms like a significant weight loss, chronic or persistent diarrhea despite the treatment, or any bleeding episodes in the recent past, and any family history of cancer. These are the things which make us always think in terms of other possible diseases, in which case we will be evaluating the patients in certain lab tests like the stool test, colonoscopy, to rule out the other major diseases like IBD, which is often confused with IBS by many patients, and also the malignancies, especially in patients more than 50 years age group. Whenever they present with the new onset symptoms of IBS, they should always be checked for the presence of malignancy or any other chronic diseases. So this is the usual diagnostic pattern how we diagnose the disease, and there is a definite criteria called Rome criteria for through which the clinicians diagnose this disease. The Rome criteria says that the symptoms should be present for at least 3 consecutive months, along with presence of change in the stool frequency or change in the stool consistency, which is more specific for this IBS. And regard once the patient presents to the clinic, we'll examine, and most of the times the clinical examination will be normal without any much findings. But the laboratory tests also may be non-specific, like the CBC, CRP, ESR, and the stool reports can also be normal, and the ultrasound abdomen also may be normal, giving us a clue that the patient may be having an IBS. If the patient's investigations reveal any of the abnormalities, then probably we should work forward in that direction to rule out any other organic disease. And once the diagnosis of IBS is decided for a patient, we need to go ahead forming treatment protocols for each and every patient. And there is no specific universal treatment for this IBS. It needs to be highly individualized according to the patient. And each patient of IBS is different, because if the patient has diarrhea predominant IBS, we will be treating them with a different protocol like the antidiarrheal medications, antispasmodics, and if the patient has constipatory type of IBS, we will be treating them with the high fiber diet and the diets causing low bloating and all. And the mixed type usually will be associated with the treatment of probiotics and others. And of course, if the patient is also having a psychological component like anxiety or depression, that also needs to be assisted by the psychiatry team for by using the biofeedback mechanisms to relieve the symptoms to some extent. Like this, the treatment of IBS is a highly individualized treatment. There is no specific universal thing. Yeah, diet wise, I would like to emphasize certain things like there is something called low FODMAP diet, which probably most of you are aware of nowadays. The FODMAPs are the fermentable oligodimonosaccharides and polyols, which are present in many foods which we consume regularly. And these FODMAP diets are supposed to cause aggravation of diet symptoms in case of IBS. So, clinically, we will advise the patient to follow low FODMAP diet in case of IBS, and also not only the medication, the lifestyle in the form of small regular meals, regular physical activity, keeping the stress levels to the minimum, having good time with family. All these factors increase the well-being, because the IBS is not just a disorder of the bowel, but it is a disorder of a general well-being mentally and physically. So keeping in all these points in view, just I would advise all our patients to think whenever you are having any new symptoms of IBS, please try to approach the doctor to get all the doubts clarified, and your doctor will be helping you to uh, really identify whether it is really IBS or not, or is it something else, and that needs to be treated. And yeah, definitely you will be benefited, and all your doubts will be clarified.
Thank you very much, doctor. That was a very well explained, detailed information on IBS, and I believe a lot of people would have got their answers with this explanation. I've got some questions here. I'll just ask you the question. Ms. Sunita is asking, what dietary changes would you recommend for IBS, and should one consult a dietitian?
Yes. The diet forms an important part of the IBS treatment. Yes, because as I was mentioning, the diets containing highly fermentable products called the FODMAPs, which are usually present in caffeinated products, as well as the especially the processed foods, fructans, which are used as the artificial sweeteners in many of the foods, and the other foods which are highly rich in proteins and saturated fats. These are the usual things which are supposed to aggravate the symptoms of IBS. So, in various countries, according to the food habits, a specific low FODMAP diet was designed for IBS patients. Usually, the low FODMAP diet consists of consumption of a more soluble fiber, because many patients think that the consumption of fiber will be helpful for the treatment of IBS, and they consume from the over the counter, but they don't know how much amount of the fiber needs to be consumed. So fiber forms an important component of the diet in IBS patients, especially with constipation. But whenever we are consuming the fiber, it should be a soluble fiber rather than insoluble fiber. If we are using insoluble fiber instead of soluble fiber, the symptoms may fire back or may get aggravated, and the patients will land up in more agony than the relief. So that is a very important discrimination while using the over-the-counter fiber supplements. I will advise all my patients to see whether it is a soluble or insoluble fiber. Coming to the next things like the fat-rich diet, which is again a point of concern in almost gastroenterology, cardiology, and other fields for a general health. So diets containing high amount of saturated fats are proven to be aggravating the symptoms of IBS in many patients, like the cheese and the butter and the diets containing chocolate products, the bakery products, and the diets containing preservatives. All these things are supposed to be aggravating the symptoms in IBS. So, ideally speaking, these things needs to be minimized in the consumption. Yes, one may be getting a doubt whether what diets needs to be consumed a little more. The freshly prepared food with vegetables and lean meats are the healthiest diet to be consumed by many of the IBS people, which has less side effects. And anything which is freshly prepared at home, either a vegetarian or non-vegetarian recipe, should be good. And yes, some of the specific foods containing probiotics like the yogurt, kimchi, these are the things which also help in reducing the mucosal inflammation of the gut and help in the reduction of the symptoms in IBS. And of course, while consuming the food, we always advise the patient to consume in small amounts, frequent intervals, because of the uh, comfort levels the gut will feel. Because there is something called migratory motor complex in the gut, which is called the cleaning wave of the gut, which happens to clean all the unnecessary material in between the feeding periods. So this becomes more regularized if you take small frequent meals rather than having a large meal at a time. In this context, I would like to emphasize the importance of fasting also, because nowadays the month of Ramadan is approaching. They will be getting the doubts like, how will be my IBS related to my fasting? Can I go for fasting? Yes, we can go for fasting even if you are having the IBS. But while breaking the fast, we will advise all our brothers and sisters to have small meals with lots of liquids rather than having a large meal after breaking the fast. That helps us the gut to recover slowly in a phased manner, and slowly you can increase the diet over a period of 1 or 2 hours, which will not aggravate your symptoms of IBS, especially if you are having IBS already before starting the fasting. So this is how a fasting in the period of Ramadan needs to be monitored as well as to be followed. So please don't take heavy meals after breaking the fast. Try to take small, frequent meals with lots of fluids. That will help you a lot after during this period.
Thank you so very much, Doctor. Doctor, I've got another question from Mr. Faraz, where he's asking, can sleep cycle change lead to IBS?
Yes, Dr. Faraz, definitely. Because sleep and gut are interrelated many a times. Not only in terms of IBS, many of the gut diseases are related to sleep disturbances. Especially, we can see in people who are having a frequent shift system in their employment places. If a person's sleep pattern is changing repeatedly in the form of frequent night shifts or frequent sleep timings, or if there is a chronic sleep disturbance, definitely that creates a kind of stress environment inside the brain. And of course, the brain is the master organ controlling all the other parts of the body. So there is release of certain things like the excess release of 5-hydroxytryptamine, a specific chemical in the gut, which will increase the propensity to have diarrhea in some people, and other chemicals like the neurokinins and the calcitonin-related peptides, which are usually identified to be high in numbers in case of IBS people who are having this sleep disturbance. But of course, it is again a point of discussion whether this sleep disturbance is causing the IBS or patient is getting the sleep disturbance because of IBS symptoms is a point for a different debate. But it is for sure that a sleep disturbance can for sure aggravate the symptoms of IBS.
Thank you so very much, Doctor. Doctor, another question from Dr. Asya. She's asking, can children affect with IBS? Are the symptoms same as adults?
Yeah, IBS in children is a relatively rare entity in the clinics, but whenever both the parents are having the IBS, there is a chance that 25%, that means at least one of the four children, have a chance to develop IBS when they grow up. And also, it depends on the lifestyle of the children, how stressful they are since childhood. In this context, there is a theory which is made and also being studied that children with the childhood abuse, either physical or emotional, are studied in various countries and are found to have early onset of these IBS symptoms. But yes, the studies are still ongoing and the results need to be finalized. But definitely, a long term stress in childhood can precipitate an early onset of IBS. But the symptoms may be as severe or maybe less. That depends on the totally depends on the how much trauma they are going through in the childhood and also what type of lifestyle they are going through in their adulthood.
Thank you very much, Doctor. I've got some questions here that were sent to us by our members who will be watching you at this time or maybe later. I would like to ask some of the questions from there. Doctor, Mr. Prakash has asked, he sent a question. I have gas discharge when eat nuts, especially peanuts or cashew nuts. How can this be minimized?
The nuts, especially the cashew nuts, peanuts, and the pistachio, which are commonly consumed, have a high content of saturated fat as well as a high protein content. These are good in food quality, but at the same time, because of this high protein content, which is rich in sulfur as well as this saturated fats, they form a lot of fermentable products in the bowel, like the small intestine or the colon, because of which there is a lots of gas production because of the intestinal bacteria while interacting with these residual foods. So there is no surprise that somebody is consuming the nuts can have a little bit of extra gas production in the bowel, especially if their gut bacteria has already have an altered pattern of behavior. Because many people will be consuming nuts, but only few people develop these symptoms because their gut microbiota, that is the natural flora of their gut, is behaving slightly abnormal. Usually, in these cases, we advise the patient to consume a lot of fluids as well as to decrease the consumption of nuts as well as to use the probiotics to get relief. But of course, it needs to be decided once the patient is examined clinically.
Thank you very much, Doctor. I've got another question. Doctor, is continual use of PPI to manage IBS harmful?
Yeah, yeah. PPIs in IBS. The symptom of bloating in many people of IBS can be because of either IBS or maybe ongoing gastritis also. So, if the clinician thinks the patient is also having a coexisting gastritis, they may prescribe PPIs, that is the proton pump inhibitor like the pantoprazole, rabeprazole. These drugs tend to suppress the acid production by the stomach and thus causing healing process promoted in the stomach. But they also, on the other hand, remove the protective barrier of the stomach from the infections, which forms the first step in the development of an entity called SIBO. Because whenever this protective acid barrier is removed, there is more chance for the bacteria to grow in our stomach as well as the intestines. And we all well know that SIBO is one of the important factors contributing to the symptoms of IBS. But yes, usually we did not see this side effect in young people below 50 years. But if the person is of more than 50 years and having comorbidities like the diabetes or using any other immunosuppressant medication, chemotherapy, and yes, very elderly like 70 plus age group, usually should not be prescribed on long-term PPAs because there is always a chance of bacterial infections, which is scientifically proved. So it is better to limit the PPA usage to less than 6 weeks in people who are at risk, like comorbidities and elderly people. But in young people, a regular course of PPA for about 6 to 8 weeks should not be causing a problem.
Thank you very much, Doctor. Doctor, what could be causing frequent bloating and gas pains? This is a question came from Miss Elizabeth.
Frequent bloating and gas pain is a very wide array because it can arise from different parts of the gut, maybe the upper gut, mid gut, or the lower gut. So if the problem is in the upper gut in the form of gastritis or the gastroesophageal reflux disease, and yes, whenever there is altered stomach motility, the bloating can be originating from the upper gut. If the patient is having any small intestinal problems like the celiac disease, food intolerances, or lactose intolerance, or any classical IBS, SIBO, and parasitic infections, then also they can have this bloating and the excess production of gas, and any colonic problem in the form of again IBS, especially the constipatory type of IBS, have this bloating as a common manifestation. And of course, depending upon the lifestyle and the food habits of the patient, it again depends the intestinal bacterial behavior. So, if we think the intestinal bacteria are behaving abnormally from their natural way, there is always a chance to produce abnormal chemical and as well as abnormally excess amount of gas in the intestines. So, the lifestyle and the food habits of the patients very much actually affect the uh, development of this gas as well as the bloating in many patients. There are various number of causes to cause this bloating and abdominal discomfort and excess gas production, but these are a very few to name.
Thank you very much, Doctor. Doctor, I've got a question here. What could be the solution to a condition where a person passes frequent gases in a whole day, regardless of eating or not eating at night or morning? How do you look into that? What would be the solution to that?
Yes, first of all, we should be knowing whether the person is having a pre-existing gut condition or not, because the bloating and frequent passes of stools is related not only to the just food and the gut health, it also is related to some amount of lifestyle changes. If the and also some of the medications used by the persons also can cause excess production of gas in some conditions. So before considering the workup, we should take a detailed history of the patient's lifestyle and any recent changes in the food style or the lifestyle, and if is the patient using any kind of medications, or is there any sometimes the surgeries of the intestine and colon can alter the intestinal bacteria and anatomy, causing a lot of production. This altered anatomy can alter the movements of the bowel, causing them to pass the gas very frequently. So all these factors needs to be considered before considering the patient what exactly is the reason for this. Of course, there are certain lab tests to detect why the person is passing too much of gas in the form of checking for the certain diseases like the celiac disease, where the patient can have lots of gas passing after consuming the gluten products, and the people who are intolerant to dairy products in cases of lactose intolerance, they can also have lots of gas passing after consumption of dairy products. So all these entities need to be checked through various laboratory tests before coming to a conclusion,
Okay. Thank you.
and
Thank you very
accordingly
much.
need to be treated.
Yeah. Doctor, I've got a question from Mr. Muhammad Jamil. When the ulcer gets active and how to avoid get ulcer active?
Okay. Ulcer is a specific entity happening anywhere in the bowel, starting from the mouth towards the anal region. Depending upon the etiology and the location, the ulcer can be found because of various reasons. The most common site of ulcers is the stomach, where the acid is more in amount. Whenever there is an ulcer in the stomach, the ulcer may be active or inactive. Inactive ulcers usually does not cause any clinical symptoms, but if there is a second injury in the form of any medication like painkillers, or if there is any ongoing stress in the form of change in the food habits, change in the lifestyle, change in the stress levels, definitely all these will increase the acid production by the stomach, and thus an inactive ulcer can get converted into an active ulcer because of this additional injury in many cases. Of course, in the small intestine and the large intestine called colon, the ulcers have a different pathology basing on the bacterial content and behavior of the natural flora of the intestines. Accordingly, they may change their behavior to get activated. But nowadays, it is identified that any kind of abnormal change or sudden change in the food habits or lifestyle changes can make an inactive ulcer into active ulcer in many studies going through the globe.
Sorry, thank you so very much, Doctor. Moving towards the end of the session, I've got just one question that I would like to ask, and after that we move towards the ending. I've got a question here from Dr. Supriya Jain, I believe, and the question is: Are IBS patients at increased risk of heart attack, Doctor?
IBS, okay. So thank you, Dr. Supri, for the asking question. Uh, IBS patients are usually having some cardiac symptoms, like what we call it as extra-intestinal manifestations of IBS, in the form of palpitations and syncopal attacks sometimes when the symptoms are severe. But so far, none of the studies have identified that the IBS can lead to any long-term serious illness in the form of a cardiovascular events or cerebral events or even the malignancy. But yes, if the patient is having any coexisting comorbidities like already pre-existing CVD, a coronary vascular disease, or previously uh, stunted patients like the post-PTCA patients, with the aggravation of this IBS symptoms, there may be a chance that they may land up in a bit of cardiac compromise situation, but clinically, this entity is quite less common.
Right. Doctor, thank you so very much for answering all those questions. It was really great, getting all the information from your end to our audience. I believe a lot of information has been given, and of course, it will be there to everyone. You can always who will be missing out the live session. They can always watch it later. It's there on YouTube. It's there on Facebook. It will be really helpful. A very important topic that we have covered today is irritable bowel syndrome. Thanks to Dr. Srinivas, who have given us a lot of information on this.
Thank you.
Doctor, thank you so very much. Before we end up this session, I would like to request your recommendation is really, really very important. Please give us your feedback with your reviews on Google and Facebook page of Prime Health. So always maintain the quality for our patients, for our members, and you can always download the mobile app, Prime mobile app, Prime Health Me, that you can see at the bottom scrolling and for Android and iOS, and you can book an appointment with Dr. Niwas on the application, or you can always call our helpline, that is 04707099, and you can book an appointment accordingly with him. We've got some appreciations also. Thank you so very much to all for listening to the doctor, and of course, if I'm sure about it, that it was really helpful to everyone. Thank you very much. As Prime is all about personalized care, personally, we'll be coming back to you with another live session sooner with the new topics. Thank you very much, all. Take care. Bye bye.